My name is Sally Crabtree, and I am a registered nurse. I work in labor and delivery at a local hospital. I really became interested in nursing since I was a small child. I had always a fascination for caring for people, for dealing with babies and mothers, and that whole relationship between the two really fascinated me. Middle school, high school, I realized that nursing can really deal with that one-on-one type of relationship. So I started taking different courses in high school that would lead me to maybe developing my interest further in the nursing fields. I, in fact, really became interested in the health and sciences and felt like that was really a strong aspect in my career and in my education. So I did pursue nursing in college, and I went through 4 years of college and got my bachelor's in nursing and became a registered nurse. And I did a couple different courses through my nursing education in OB, which is obstetrics, and labor and delivery, and dealing with babies in the nursery and all that. And that really piqued my interest even further, and I really could tell that that's what I wanted to do. I graduated and found a job that allowed me to be in the OB department, and I've been doing that for the past 3 years, and I wouldn't want to do anything else in nursing besides OB. That's what I love, and that's kind of my passion. And as a nurse, my daily responsibilities in my job would include either taking care of mothers whenever they are in labor, taking care of mothers, pregnant mothers, soon-to-be mothers, as they may develop difficulties during their pregnancy, and helping to take care of them and so they can deliver a full-term, healthy baby when the time is needed. I also take care of babies after they are born, if they should need to have their blood drawn, if they need, obviously we do vital signs on mothers and babies, and I also care for mothers after they have their babies. So make sure that they are doing okay, make sure they understand how to take care of their babies properly. I administer medications to both the babies and the mothers. I also help the doctors out and the social workers out so we can all have a cohesive group that works together and can develop a good relationship with our patients and take wonderful care of them. Some important characteristics that a manager or a employer in the hospital setting for nursing, it's important to be well qualified and have the education that's necessary to be a nurse. It's also important to have a positive outlook on yourself and what you are doing, so that is portrayed nicely to your patients. It's also important to be organized, to have a team approach, to get along well with other people, and it's also important to be assertive so you can stand up for yourself but also take care of your patients. Some things that I enjoy most out of my nursing career would include getting to know my patients and developing a respect for them and a trust with them, and getting to know all different kinds of personalities and coming into someone's life and making a huge impact. I feel like I really, really like to teach, and teaching is an important part of my job, and being able to teach them about what is going on that may be frightening and scary for them makes everything look a little brighter. Some of the different challenges of my job would include also getting to know many different personality types that may be a little different from your own, but being able to be that important person is also extremely, extremely important for them. Also responding rapidly to different situations is important and can be challenging because you need to know what to do at that exact moment. So having the education and having the experience is also very important. Some different influences in my life towards nursing would include my best friend's mother was a nurse and is a nurse. She has been my best friend through middle and high school, and we even keep in contact, close contact now. And her mother was a big influence in the way that she described nursing to me, how she explained all the different aspects of nursing, what she had to put into nursing and what she is getting out of nursing. So she was a big, important reason why I kind of looked into it further. Another influence was my grandmother. She was a nurse for many, many, many years, and she had always talked to me about her different stories, and that influenced my thinking, and I thought that was so neat, and I looked up to her and really respected her for doing so many different things that she did and experienced in the hospital setting. Some different courses in high school that I took that really helped me in my nursing career would be math courses, freshman through my senior year of high school. I took different health courses that they offered in order to be more comfortable and familiar. I also took many, many science courses. That was my big interest, and I thought that would help me in college, which it did, including biology, a human anatomy course. I also took a couple science courses that I actually was able to receive college credit from them that further helped me whenever I got into the college scene. Some different things that I would do differently if I was able to go back to high school before going into nursing would include job shadowing a nurse, getting into that environment and really seeing what it took and actually on the floor of a hospital to see a nurse-patient relationship. I also would take advantage of probably look into more what the community had to offer in terms of looking into the hospital setting and seeing if I could job shadow a nurse, seeing if I could get into the clinic scene, seeing if I could job shadow a nurse in that area as well. I would probably talk to a student that is in nursing so I could gain a little bit more insight from them. My advice for students going into nursing would be to get to know yourself. This is a time when you can explore many of your different interests, so really explore different things so you know if this is the field that you want to get into. I also would suggest there are many different areas of nursing that you can get into too. So just because you want to go into nursing doesn't mean you have to focus on one thing and one thing only. You can change your career or your focus in nursing at many different stages of your life. You can go into business, get your master's in business. You can get your master's in education. You can be able to teach. You can be the administrator of a hospital. There are many different areas that you could focus on later that if your interests would change, that would allow you to do so. There are many different ways that you can get into the nursing career right off the bat, right out of high school. If you don't feel like you want to go to college right away, being able to get a job as a nursing assistant can be very helpful in getting that focus and that experience necessary. You deal hands-on with patient care, and you also deal with helping the nurse. There are two ways to becoming a registered nurse. You can go through a 2-year college degree by getting your associate's degree. You can also get your bachelor's, which is 4 years of college, in order to become a registered nurse. And then you can also go ahead and get your master's and your PhD if you would like to go into business, go into education, go into becoming a nurse practitioner. Those are different ways that you can even further that nursing degree. There are also different classes that you can take while you are currently a nurse, and you can further your education that way by getting different certificates. They could include becoming a nurse anesthetist that would assist the doctors in anesthesia. You can also further your education by getting different certificates in becoming specialized in the heart area or the ICU area. There are many different classes that you can also take while you're in nursing that's important to further your education. The medical field is always changing, so becoming up to date and keeping educated is a big thing in the healthcare field. By working in labor and delivery, there are many, many rewarding aspects and many different stories that I have that I could go all day about that I just love. And one in particular, I had just got done with my orientation in labor and delivery after starting my job. And I was all on my own and a little scared, but I had a wonderful couple that was having their first baby, and they had their baby. It was a long, long process and an all-day event, but they finally had a little baby boy, which they didn't know that they were having. And I still remember that couple and how grateful and joyful they were for not only having their baby and being healthy, but for having me being there and me being able to be supportive and being a huge part of their life. And I will always remember that couple because it was the first time I was on my own and actually felt like a nurse. And it was also one of those things that you look back on and really think that you are lucky to be in this field and being able to help the people that you do.